I'm speaking with Dr. Richard Colbran, who has recently published an article in Rural and Remote Health titled Capability, What's in a Word? Rural Doctors Network of New South Wales, Australia is shifting to focus on the capability of rural health professions. Welcome, Richard.
Thank you, Melissa. Thanks for having me with you today, and also the chance to publish within the journal as well.
Our pleasure. It's great to see you.
We're very interested in the word capability, but before we start having that discussion, I wouldn't mind just acknowledging the traditional owners across all of Australia, the lands of all of Australia, which RDN does its work, and pay respects to elders past, present and emerging. There's a lot happening at the moment around the world in terms of First Peoples and First Nations, and I think it's important at this time just to acknowledge the pursuit of equality across all of our healthcare systems. I just thought that was worth calling out today as well. But we're very, very pleased to be able to bring our sort of discussion paper to the sector in terms of the word capability. For those that may not be aware, I'm the Chief Executive of an organisation that's called the New South Wales Rural Doctors Network. We're a non-government independent charity organisation that's been around for just over 30 years. And we work fairly, or predominantly in terms of creating access or searching for access and equity of access to quality healthcare in remote and rural and regional communities, so non-urban communities. But we do that with two particular lenses. The first is building a workforce and retaining that workforce in rural and remote communities, but also marrying that with service models as well, and trying to consider what are contemporary service models and contemporary ways of thinking about matching the workforce to those models. And we've come to realise that there's a reframing necessary in the contemporary way of thinking around not just the approach to attracting, recruiting and retaining health workforce in rural and remote communities, but also the idea of what works for medium and longer term sustainability and viability of that workforce. And we feel that the idea of capability fits with that.
Fantastic. So what do you mean by capability?
So over the last 2 or 3 years, we've really undertaken a bit of soul searching, a bit of deep thinking about where we've come from as an organisation. I'm still relatively new in the role, so I've spent a lot of time talking to some of the old guard of our organisation, the work that they've done over those 3 decades. And what became clear to me is that it's very, very important not to forget that we're actually in the business of people. And so much of the pressures that we face in rural and remote health really do get us towards talking about fast fixes and driving through a fix in terms of securing a solution. But I think with that comes a risk sometimes to forget about the people that we're dealing with. And I've come to see that most of the very successful recruitment strategies that have been undertaken do take the personalised approach. Now, sometimes the personalised approach is very hard to scale because, becoming very entrenched emotionally and connected to people through that recruitment and also building those strong connections into community. But the reality is today that the old way of working of one doctor, one town for 40 years, that's gone. And if you're pursuing that, you're wasting your time. And it's very important now to marry a local community need and appreciate that local communities and local towns and their workforce can contribute in a regional method as well, but also then to appreciate that the lifestyles that people are working through at the moment are very different. I've met doctors and nurses and allied health workers that actually have never been on holiday as a family from their rural community. And that's, they're the sort of examples now that just aren't going to work. And we see people now meandering through a lifetime of career in rural as opposed to connecting and securing into one town. And that really is at the heart of the capability approach. We need to understand what makes people tick professionally, emotionally, physically, spiritually, and look to try to support them and nurture them and build them to have very successful and fulfilling lives. And lives aren't just about their personal life, it's also their work life. I don't really like talking about work-life balance. For me, I talk about life balance because work's a part of life. And for us, that's at the heart of this capability approach. So we're trying very hard to understand the uniqueness of each individual and support their career across the whole of their lifespan and find the particular aspects and opportunities that come for them throughout the course of that life cycle.
Well, that sounds wonderful, Richard, and I'm sure everyone will be really interested in reading your article. So thanks very much for talking with us today.
Thank you, and happy to take any feedback or suggestions as well from people who do read it. Thank you.